Hey guys, we're back in the office. I'm here with one of our beautiful patients. She's one of our regulars and I'm super excited. We're doing a little bit of RHA filler on her today. We're gonna walk you through the plan. So she's done some filler in the past, so we're really doing some finishing touches. What we're gonna do is touch up her cheeks. She's starting to get just a little bit of separation. As we age, these fat pads actually separate. You lose bone and you lose fat in the face as you age. So these little fat pads start to separate. Just a touch of filler in there can help to smooth that out. So we'll do that on both sides. Then we're gonna move down the face. We're gonna do a little bit of nasolabial fold pop here, help to soften these lines a little bit for her. Then my favorite part, I've been obsessed with this lately, is some lower face rejuvenation. And she is the perfect candidate because Dr. Franco actually already did her My Elevate. So props to you, Dr. Franco. She looks fantastic. Look at this jawline. So she really doesn't need a ton of filler down on bone here for sharpening her jawline because she already looks really sharp. So what we're focusing on is, some people call this a marionette line, where we start to get these lines down underneath the mouth, and then we get some shadowing beneath the lip. So same thing here, we're losing fat, we're losing bone, and our tissue just starts to kind of fold in on itself. So we'll come in with a cannula here, avoid any vessels. It also helps it not to be quite so painful. And we'll just lay some filler right through here, very soft. I love to use RHA for this because it's made for movement. So when she laughs and smiles, moves her face, after that 2-week mark, it's gonna be fully integrated and you'll never see it. So we'll get rid of those shadowing, and then lastly, we'll come in and just do a tiny touch up here on her pre-jowl where she's starting to just get a slight indentation there. So it's gonna be great. We'll share some immediate before and afters with you, but the real magic is gonna be after about 2 weeks. She said she would come back. We'll take some after photos for y'all, so stay tuned. Okay, so we have touched up her cheeks. We just supported that little crease she was getting right across the mid-face there. Already looking great. Now what we're gonna do is actually an injection right into her piriform here. For people that have slightly deeper nasolabial folds, they may not be great candidates for the superficial technique that we sometimes use here. For her, I'm actually gonna do a combination of both. It can be a little bit spicy, which is why I've got the Pronox for her. We numbed her. Just 1 injection per side, but it can make a really nice difference just to lift that tissue. One thing I always point out is it can make your lips feel slightly numb, and that's from the lidocaine and the filler. So totally normal, doesn't mean anything's wrong. It actually is helpful if you're gonna be moving down the face as we are, so I like to do that first. Let's do it. Okay, so we finished the piriform injection. Now we're gonna move on to the superficial injection for the nasolabial fold. I love to use RHA2 or RHA3 for this. In this case, we're gonna use RHA3 because that's what we'll be using in the lower face. We're gonna put the filler right intradermally, or right in the dermis. So that means we're gonna actually go right through this little fold. We're gonna do some cross hatching, essentially just like this, to help pop that fold out. I use RHA for this because it's super reliable and that I can melt it right into the tissue. It's gonna turn out beautiful. I know she's not gonna see it when she's laughing, smiling. Again, it's made for that movement. This is the injection that I tell them when you leave, you're gonna look a little bit inflamed, you're gonna look a little red, you're gonna love it. Just, let the inflammation go down, let it integrate into the tissue. By that 1 to 2 week mark, you're gonna be obsessed. Okay, so time for my favorite part, lower face rejuvenation. We talked about this earlier, but what that means is we're going to use, in this case, I'm gonna use RHA3. You could use any medium stiffness filler, but you definitely want something that's made for movement, made for motion, because you don't want them to feel stiff or firm around their mouth. So we're gonna use a cannula for this for a couple reasons. One, I think it's the safest way to treat this area. We're able to avoid blood vessels, avoid disrupting her tissue, because a cannula looks a little scary. It's longer, but it's actually a blunt tip, which means it's not sharp. So we'll make one little entry point about here, which will allow me to slide my cannula through here, all through this, like right beneath her lip, her chin area, in this marionette line. And we'll just lay little droplets of filler all through here to put that structure back in the tissue. We never want to make her look like somebody, not her. We just want to make her look probably like she did maybe 5-10 years ago. So that's the goal. Okay guys, little halftime show for you. We just finished the lower face on her right side. So this side here, this is super natural. So it's not gonna be something where she's gonna like go out and her friends are gonna be like, oh, you put filler there. No, the goal is that they can't tell. But if you look very closely, you can see how much more supported she looks on this side. She's got the shadowing over here that I can't see here anymore. And then right here where she's getting that marionette line, much improved on this side. And then lastly, we supported her little pre-gel here, so you can see that that little indentation or divot is already less on this side than this side. Hey y'all, we're back in the office with our beautiful patient. I did her treatment 2 weeks ago, and we focused on lower face rejuvenation, which has gotten super popular around here. I know we shared a detailed treatment video with you, but I just want to remind you what we did. So we focused on the lower face. We did treat her nasolabial folds and her piriform aperture. So, and I always tell everybody, we're never going to completely make these folds go away, especially if they're a little bit deeper, but we've definitely softened them, brought this up a little bit. And then we used our cannula with our filler to support this marionette line, this kind of thumbprint area where we were getting just a little bit of shadowing. And then lastly, did some sharpening along her pre-gel area here. So overall, she looks fantastic. I can't wait to share her before and after photos. I tell everybody with this type of procedure, my goal is for people to be like, you look refreshed, you look great, but not like, oh, you got filler here and here and here. So I think we did that for you. You look great. Hey y'all, we're back in the office with our beautiful patient. I did her treatment 2 weeks ago, and we focused on lower face rejuvenation, which has gotten super popular around here. I know we shared a detailed treatment video with you, but I just want to remind you what we did. So we focused on the lower face. We did treat her nasolabial folds and her piriform aperture. So, and I always tell everybody, we're never going to completely make these folds go away, especially if they're a little bit deeper, but we've definitely softened them, brought this up a little bit. And then we used our cannula with our filler to support this marionette line, this kind of thumbprint area where we were getting just a little bit of shadowing. And then lastly, did some sharpening along her pre-gel area here. So overall, she looks fantastic. I can't wait to share her before and after photos. I tell everybody with this type of procedure, my goal is for people to be like, you look refreshed, you look great, but not like, oh, you got filler here and here and here. So I think we did that for you. You look great.